My name's Robert Patterson. I'm 74 years old and I was diagnosed 2 years ago with prostate cancer. I had a PSA of 8.6, a Gleason score of 9 and a staging of T2B prostate cancer. Well, I've always done volunteer work in one form or another for the last 50 years or so. And what I found was that when I looked at this issue of prostate cancer in my case, that the prostate cancer support group here in Vancouver provided a huge amount of understanding for me. And I learned that, in fact, every patient is different in one form or the other. He might have a different clinical diagnosis. He could have a different stage in his prostate cancer development. He can be under different treatment regimen. And I felt that my experience might be able to contribute to somebody else who was struggling with the same kinds of issues that I was facing when I first was diagnosed with the disease. What is the most helpful piece of advice I was given with respect to the treatment protocol which will be applicable in my situation? A friend of mine who is a senior physician in the Vancouver hospital here advised me that, based on his information, the BC Cancer Agency has a reputation second to none in terms of its ability to treat prostate cancer, breast cancer and lymphoma. So that in going to the BC Cancer Agency, I knew I would be working with somebody, rather an organization, that was a first-class organization within Canada. Then I had a discussion with my urologist, who told me that 2 years ago he would have recommended radiation therapy with the BC Cancer Agency, but that surgical procedures had advanced to the point today where it would be 6 of one, half a dozen of the other, whichever I happened to choose. He did, however, refer me to the Cancer Agency, where I got essentially the same information, so I was left with the need to try and decide on which of the two tracks I would go. The tiebreaker is the National Cancer Communications Network, NCCN, who have a series of clinical practice guidelines, and for my particular situation there was a Category 1 recommendation that radiation therapy together with androgen deprivation therapy for 2 years to 3 years would be the preferred recommendation for treatment of my particular situation.